Patient comes to ER or an hospital complaining of chest pain. Most of the time the chest pain is either due to indigestion or spicy food, increased caffeine intake, stress. These are very common conditions that we see. So most of the time it is gastric related issues or stress related issues or not well controlled hypertension where the BP is on the higher side, or sugars not well controlled, or with previous intake of fast foods there is dyslipidemia or high cholesterols which can also cause chest pain. Stress cardiomyopathy, that is because of excessive stress. People, some of them we are seeing with stress cardiomyopathy, and we also have to be careful and we should not miss out cardiac conditions like an acute MI or acute heart attack. Hi, I'm Dr. Harish K V. So today we are talking about chest pain. Chest pain has been one of the common symptoms that we see day to day. Patient comes to ER or an hospital complaining of chest pain. Most of the time the chest pain is either due to indigestion or spicy food, increased caffeine intake, stress. These are very common conditions that we see. So most of the time it is gastric related issues or stress related issues or not well controlled hypertension where the BP is on the higher side, or sugars not well controlled, or with previous intake of fast foods there is dyslipidemia or high cholesterols which can also cause chest pain. Stress cardiomyopathy, that is because of excessive stress. People, some of them we are seeing with stress cardiomyopathy, and we also have to be careful and we should not miss out cardiac conditions like an acute MI or acute heart attack, or it could also be pneumothorax. Patients who are smokers who would suddenly develop breakage of an emphysematous condition caused pneumothorax. Certain conditions like pneumonias which can also present with fever causing chest pain, and sometimes we have also seen intercostal herpes zoster which can cause chest pain, and malarial zoster which is also causes chest pain. So there's a lot of conditions which come under this. So whenever there is a chest pain, it is better you see your doctor, take an advice from him, correct your diet, correct your weight, bring your BP sugars under control, then work for your cardiac. If there's any symptoms that has to be picked up or it has to be investigated, and then start working back on your regular dietary and exercise changes. Left-sided chest pain, most of the time again it could be gastric related, it could be a collapse of the lung in smokers or drug abusing people, or it could also be because of pneumonia, or it could be because of viral pneumonias or bacterial pneumonias. It also could be a consolidation of the lung because of tubercular changes, or it could be a pleurisy, or it could be teats, what we call, where there is costochondritis or inflammation of the costochondrial junction. So these are some of the conditions we should look for based on what cause it is. Also you have to not miss out on cardiac acute MI or heart attack. So based on the cause, left-sided chest pain has to be treated. If it's pneumonia, go treat pneumonia. If it's tuberculosis, treat it. If it's acute MI, treat it. If it's a gastric issue, go and treat it. So it depends upon the cause of the left-sided chest pain, and the treatment falls in line according to the cause. A right-sided chest pain usually is not considered a cardiac chest pain, but it can also be one of the cause. So keeping that in mind, best is to do an ECG first, rule out a cardiac condition like MI, and then follow up with respiratory causes. As I told you, pneumothorax, hemothorax, or it could be a consolidation or an infective causes like pneumonia or tuberculosis, or even an emphysema that is commonly seen in smoking people. It also could be because of acute breathing issues because of a foreign body, and it could be an infection, it could be a pleural infection, or it could be an herpes zoster that occurs around the intercostal margins. So these are some of the conditions. they are treated again according to the cause. You don't take it as right-sided chest pain and treat everything as same. It depends upon what cause it is. Based on that, you have to treat the condition. Chest pain in women, usually we also see in pregnant women. There's a lot of reflux that is happening. And in younger generation, because of stress, they could develop reflux, gastroesophageal reflux diseases. They could also develop an H. pylori infection causing acute chest pain. And also in an younger individual, it is more of causes like smoking to be ruled out, or drug abuse, or stress, or if they are on some hormonal pill to manage PCODs, we have to assess that. In elderly, we also have to rule out cardiac, coronary artery diseases, MI, ischemic heart diseases, and also we have to look at other causes like postmenopausal symptoms, anxiety disorders, depression, and we should also rule out respiratory causes like pneumonias, viral infections. Best is to evaluate to diagnose the condition of a chest pain in women. Like if it's a gastrointestinal causes like gastroesophageal reflux disease, or if it's acute gastritis, or if it is something to do with gastric related issues, better to get an H. pylori blood test done or do an endoscopy, upper GI endoscopy. Also to rule out cardiac problems with an echo, treadmill test, basic blood tests like cholesterol, sugars, check on BP, and also check on thyroid, and also look at respiratory causes by doing a pulmonary function test, chest X-ray, or a CT of chest. These are some of the investigations that can be done to diagnose a particular cause for the chest pain and then treat it accordingly based on the condition or the disease that has been diagnosed by investigating. Yes, continuously if you're sleeping on one side, there are certain individuals who are caught sleeping on one side, which causes chest pain because of constant pressure to those muscles and ribs. And this can also cause chest pain. So it is always better to move to different sides, to the right, left, or supine position, so that pressure is not on one particular side and the pain is relieved. Needle-like pain in the chest, again it's of different types. It could be a mild gastric or an acute gastritis, or it could also be a mild pleural change like a pleural thickening or pleurisy. It could also be mild cardiac related issues which has to be assessed. So it's better you investigate on this with a chest X-ray or a upper GI endoscopy or a treadmill test and treat it according to the condition diagnosed.